Hi everyone, Dr. Jeff back with you this week, and this week we've got a great question, something I get asked all the time, or quite regularly anyways. Would a cortisone shot help me?
So you may be wondering, what is cortisone and what is a cortisone shot? So cortisone is a strong anti-inflammatory steroid that can be injected into your body and joints to help reduce inflammation. It's great for any sorts of itises, so if you're dealing with arthritis, bursitis, tendonitis, plantar fasciitis, the shot can help reduce inflammation in that area. Cortisone is a type of cortisol, which is a naturally occurring hormone in your body produced by the adrenal glands, which again helps with inflammation and the immune system response in your body.
Yeah, it used to be, it is a very powerful anti-inflammatory. Inflammation is not good for the body. It can actually create swelling, which means it's creating a pressure and cause pain. And you can have acute swelling, like you sprained your ankle, or you could have chronic swelling that you've had for a long time. But the body doesn't really know the difference between being shot or being stabbed or having a cut and spraining an ankle. So all it knows is there's been an injury. So the body automatically creates this big barrier of inflammation. So it wants to protect the body from any type of inflammation or any type of infection that might be coming in from the cut or whatever it is. It's really good, again, if you've got a cut, but not so good with a sprained ankle. So this wall of inflammation will have a bunch of red blood cells, white blood cells, neutrophils, macrophages, this big barrier. And if you sprain an ankle, what can happen is now this big barrier pinches everything off, and you can't actually get blood in and out of the area, so no healing can go on because of this big wall of inflammation. So this is something we can't get rid of, and generally after a few days this inflammation is going to break down, but if it's staying on very chronic, we can't get rid of it. That's when a cortisone shot may be helpful to help get rid of that wall of inflammation.
Yeah, so since a cortisone shot is such a strong anti-inflammatory, it's recommended if you were to get one only once or twice a year. You may feel the effects and benefits of a cortisone shot within a few days or within a few weeks, and the benefits can last up to about 3 weeks or even a few months. The cortisone shot can be injected just with a needle, or sometimes it can be injected with ultrasound, so they can see exactly where the shot is being put into the area.
Yeah, it used to be, like, I know when cortisone first came out, it was considered this miracle drug. You see the quarterback hurting his shoulder, and they go into the locker room and inject him with some steroid, and you come out and be throwing the ball like nothing ever happened. But it used to be really considered a miracle drug, but now they've discovered there's a lot of side effects to this. And one of the side effects is actually leads to arthritis. So if you go on the website for a lot of sports clinics and you look up their cortisone, it will actually say on it that to beware that this may lead to arthritis. That's because the cortisone, if it goes into the cartilage, it can actually damage the cartilage, and the cartilage is what gets eaten away when you're getting arthritis. It's also not very good for people that are diabetic. It really can wreak havoc with their blood sugars. I've had patients come in that are diabetics, and it takes them weeks to get their sugar balanced after their cortisone shot. So you have to be worried if you're a diabetic and getting a cortisone shot. It also is very harmful to bone. I actually had a lady come in one time, and she got a cortisone shot in her elbow for tennis elbow, and she had no end of her bone, of her radius had disappeared because the cortisone had eaten it. It's also not good for bone density. So if you are suffering from osteoporosis, you have to watch that getting a cortisone shot, because it actually lower your bone density a little bit. And you also find that will reduce as you mentioned, it reduces your immune system. So it reduces that wall of inflammation. That's what it does. So it leaves you more open for infections, so colds and flus and stuff. So you have to watch for that. And also, some people find they get flushed after, they get tired after. You also get tenderness and soreness over the injection site. So this is the reason why that a lot of places are going to want you to try conservative care first. So whether that's shockwave, physio, laser, IFC, all these things to try and get rid of, over-the-counter types of anti-inflammatories like Advil or Aleve, to try and get rid of the inflammation before we go to cortisone, because there are a number of side effects for cortisone, but if it works, it can work really well.
Yeah. So if this is something you've been considering or thinking about, cortisone does work really well if you get it, but again, there are many side effects. So definitely talk to your practitioner, doctor, and think about the other conservative treatments that you can do before choosing getting a cortisone shot.
Yeah, and a lot of times, as again, it's a last resort. And nowadays, that if somebody's getting a new hip or a new knee, they might give you a number of cortisone shots because they knew at some point they're just going to give you a new knee and a new hip. It doesn't matter if you get more arthritis or not. But if you like the video, make sure you share with your friends. Make sure you hit the like button. And if you have any questions or if anything you want us to investigate for you, make sure you send them to us. And here it goes with wellness. We got your back.